Patient, do you want to lay down with me? It's warm. I peed a little. Refusing oxygen because they didn't want to get addicted, mistaking a CPAP for a pap smear, and a patient making a very haunting demand mid-surgery. Today, I'm diving into some of the most unhinged things patients and people have ever said to doctors, nurses, and hospital staff. All right, let's dive right in. Patient handed me his phone and said, "Call someone who cares." Oh my gosh, that's so funny. In the emergency department, there are times we have to call family members or friends to get either further information, or we're asked to call them to update them. Many different scenarios, but we do not break HIPAA. Patient confidentiality, all the legal things we abide by. Patient made me hold her hand while she prayed out loud for God to send her a nurse that knew what they were doing. Oh my gosh. A lot of interesting characters that come to the emergency department, and people could be of sound mind and be saying this, versus there are sometimes people may not be aware, they might have dementia, they may have psychosis, or they might be trying to get under your skin. Things do happen like this very often in the emergency department or at the hospital. I have a lazy eye, and a patient said, quote, "Straighten that thing out when you're talking to me." It's ptosis. It's when the eyelid lags and not functioning the way that it should. This can happen to anybody, or you're tired and the eyelid doesn't open close as much, or you had a stroke and that nerve that is innervating that muscle is totally not working anymore. I was changing an elderly patient with dementia's diaper, and they said, "Watch out, it might spit at you." There are times, mostly with pediatric patients, when very young babies, and you take the diaper off. Sometimes when they hit the cold air, it's pee goes everywhere. As we get a little bit older, potentially same thing can happen. It's a little bit lack of control or in those moments, but yes, they potentially can pee everywhere. Lady told me she would give her right leg to be as skinny as me. Plot twist, she was a double amputee. Oh my gosh. Hopefully she was just being funny and joking, and this was her way of being lighthearted and a route to humor in this scenario, and trying to catch the nurse off guard, probably, or a staff member off guard, because there's no more legs to give to be skinny, but very funny. Suck in your gut. I was 7 months pregnant. 28 weeks, you're definitely showing at that point. That is normal. People, again, just say what's on their mind sometimes in the emergency department, not knowing anything else about you. Staff members at hospitals and emergency departments have thick skin, and so they're used to hearing things like this, unfortunately. Dementia patient kept saying that a tall, black-haired man was in the corner of her room. By the way, a tall, dark-haired man died in that room the day before. People do die very often at the hospital. I haven't had a patient say this to me before, but I've heard things like this where sometimes dementia patients are able to see things or know things. That would freak me out. Patient, do you want to lay down with me? It's warm. I peed a little. You don't get into the hospital bed with a patient. That staff member, tech, nurse, they have to help change the individual and change the bed. And that's why, if you've ever been a patient at the hospital, the mattresses are waterproof. Had a patient come in for a sleep apnea eval. The patient asked if he was going to need a pap smear, not a CPAP. So he was trying to use the right terms, but used the wrong terms. This happens very often. So a CPAP is a continuous positive airway pressure device, versus a pap smear is a gynecological procedure where you're swabbing basically the cervix looking for abnormal precancerous type cells. Was at the bedside of a dying patient. He said, "I'll say hello to your dad today. My dad had been dead for years." It's very interesting. Unless they gave information that they knew that your dad was dead, how would you know? We see patients that had CPR, they were dead, clinically dead, and then we brought them back to life. And so are they seeing lights? What's their experience? And is it the nerves firing in your brain, giving you different signals, versus is it truly the afterlife? Very interesting topic. Had a patient tell me that the PureWick I had just placed on her made her miss her husband. A PureWick is a new device that almost looks like a banana. in shape, and it has like a cotton vented hole that connects to suction, so it goes on the outside of the genitals to allow somebody to urinate to then get sucked away. And it's much better than bedpan, getting up somebody to go to the bathroom, or putting a Foley catheter in. Maybe could also look like an adult device. I'm not wearing this oxygen. I don't want to get addicted. Oh my goodness. Getting addicted to the air that you already breathe. No, so oxygen is, O2. We give it via nasal cannula. We give it for a non-rebreather or a venti mask. The mixed concentrations of the oxygen vary. So will you get addicted to the oxygen? No. Patient coded, got shocked with a defibrillator, came back, sat straight up, and said, "Sorry, I dozed off." Sometimes somebody could have just passed out, the electrodes fallen off, flatlined, but again, you wouldn't shock a flatline anyway. You only shock VFib and VTAC. That just means they weren't out for very long, so they still have like the whereabouts of the events that happened. Worked in psych and was sitting between two schizophrenics. One says, "Dear Lord," and the other patient responds, "Yes, my son, Jesus." I wonder if they were like able to see each other versus if they were in separate rooms. So in the ER, often you'll have patients conversing with each other that are neighbors, but they can't see each other. And so they're just having random conversations. During COVID times, I had a patient on BiPAP and so close to intubation, and he screamed at me through the mask and said, "You're a healthcare zero, not a hero." All because I said no ice chips right now. Oh my gosh, very true. Threatened often, get spoken down to. You're just trying to do what's right for the patient. The BiPAP is a mask, just like a CPAP. You really don't want to take it on and off because dealing with pressures in your breathing. So you can't eat, you can't drink. I work in surgery, and a patient told me just before she went to sleep that if she died, she would come back and haunt me. By the way, she coded and died. I've literally had a scenario like this in my medical career where somebody told me that they had died at home and then they're here at the hospital and, treated them for their medical illness, and then something happened bad again for this individual. Same thing here. Oh my gosh, somebody knew. Patient coded and died in the emergency department. The administrator asked the patient's husband which funeral home he would want to use, and he responded, "Whichever has the hottest oven, I guess." Oh my gosh. I feel like there's a standard when it comes to cremation of the temperature that you need to use. So I guess there is a scenario, but you do have time. So the patient dies and the patient will be taken to the morgue at the hospital and kept there until there is a plan, until a funeral home comes and picks up the body. I had a patient say she liked me a lot and wanted to set me up with her son. Just then, her phone started ringing and she said, "Oh, this is him now." She then proceeded to answer the phone on speaker, and it said, "Will you accept this collect call from an inmate at the correctional facility?" Oh my gosh. That's a very interesting scenario as well. Awkward. Hospital workers, doctors, we are pretty much not supposed to be dating patient family members. It's not really acceptable. Urology resident here had to place a difficult Foley. The patient's family member said, "So, how long have you been working with dingalings?" Better than saying the other words that are related to it, but you can just say like genitalia or penis. You can use the normal words, but I guess people just want to make it lighthearted of it. If you yourself are a healthcare worker and have a funny story or interaction like any of these, please drop it in the comments below. If you found this video entertaining, please binge watch this entire playlist right here. And don't forget to smack that subscribe button and turn on your bell notifications and hit that like button. That way you know every time we post a new video. Thank you so much for watching, and stay healthy, my friends.